Hello, Professor Jorge Hernández Franco. We are here in Vienna for the 12th World Congress of Neurorehabilitation organized by the World Federation of Neurorehabilitation. What is your first-hand opinion on this event so far, and have you participated in any previous editions?
Well, thank you for the invitation to the interview. I've been working with the World Federation over the last 20 years, 25 years, as part of the organizing committees. And I'm very excited that it has developed in this way, that there are more members to the World Federation and the participation in the congresses are better now.
It seems that you have a very vast and nice experience with this federation.
Yes.
What is the overarching theme of this year's Congress from your point?
Well, it's always transforming neurorehabilitation, and I think that's very interesting because this World Congress gives a voice to all the people who would like to give their opinion, to share their work, and this will provide a very rich Congress for this. For Vienna and for the people who attend. So transforming neurorehabilitation reflects all the changes in technology, all the changes in research that we are trying to show in this event.
How do you consider that extracorporeal shockwave therapy combined with botulinum toxin compares to other methods of reducing post-stroke muscle spasticity?
Well, there are adjuvant therapies that can help botulinum toxin in regard to achieving a more efficient result when injecting in neurological patients, more specifically on post-stroke patients. And the idea is to inject botulinum toxin, but you cannot inject it the interval of injection shouldn't be very short. You have to wait, for example, 3 months the least before developing antibodies. So in between, in this period, I think adjuvant equipment or adjuvant therapies like extracorporeal shockwave therapy is very important. It can add some help. It can allow the physician to have better results in the treatment of these patients.
When will established practical guidelines be available on standard parameters for ESWT in treating spasticity?
Well, I think that's a very good question because there are different protocols that are being used in different countries. Recently, I was recently in Sao Paulo, in Brazil, and the physicians there, mainly neurologists, they were showing a book that was written by all of them, most of the people who are studying extracorporeal shockwave therapy, and they tried to establish these parameters of or the way the protocols that should set the treatment for extracorporeal shockwave therapy in physical therapy in spasticity. But there are different protocols all over the world, I would say. So we still need more studies, and we need to have more communication between people who are using extracorporeal shockwave therapy.
How does botulinum toxin compare to other treatments for post-stroke spasticity?
Well, botulinum toxin is a very powerful tool that allows the physician to shape the activity of muscles. Let's talk about the muscles that are more active in stroke patients. Those are called spastic muscles. And this spasticity or this overactivity, this muscular overactivity, can prevent somehow the patient from completing a movement or of having an efficient movement, a movement that has a significance to him. So injecting botulinum toxin weakens, therapeutically the activity of the muscle that is opposing to the normal movement. So we can do it in a very specific way in the what is called antagonist muscle, and this will allow the physician to give a better treatment to the patient who had a stroke. So this calls on not only for the injection of botulinum toxin and not only for the use of other agents like extracorporeal shockwave therapy, but also we should always keep in mind that physical therapy and occupational therapy are very important for the treatment of these patients, this will translate into function recovery in the patients.
Thank you so much for
Thank
accepting our invitation for the
Thank
interview
you.
and for sharing your valuable
Thank you very much.
opinions.
Thank you
on
very
this
much,
subject.
Toria.